You hear now the circulation of misinformation about the COVID-19 vaccine poses the danger of hampering the government's efforts to control the pandemic. Social media giants have struggled to control the spread of false content around COVID-19 vaccines on their platforms. Now, to discuss the impact of misinformation and disinformation during a pandemic and all COVID-19 related issues, we now joined via Zoom by Professor Jeffrey Mphahlele, the Deputy Vice Chancellor for Research and Innovation at the Northwest University. Thank you so much for your time this afternoon, Dr. Mphahlele, and thank you so much for joining us. Dr. Mphahlele, can you hear me? Dr. Mphahlele, perhaps unmute your computer so that we can hear you.
Oops, sorry about that.
It happens.
Can you hear me?
I can hear you perfectly now. Thank you so much. Dr. Mphahlele, of course, you know, the big focus today is on...
I'm going to switch off my camera, if you don't mind.
Dr. Mphahlele, we need that television, unfortunately. This is, we need you on camera. This is a live television, unfortunately. I hope you can hear us for that. All right, Doctor, perhaps let's start with this question. The NCCC is meeting today, and of course, the Deputy President of the country, David Mabuza, is going to be chairing that meeting today. Of course, all eyes on that meeting in terms of what will come out today. You know, what can we expect given the rising numbers of COVID-19 in this country?
Well, I wouldn't really know exactly what will come out, but I wouldn't be surprised if any announcement is going to really talk against the super spreader events, because we know that this is an area that we can still do well. There are a number of events happening, and I think it is important that we need to discourage these super spreader events, especially this time of the year. I think that's the first area. And then the second area is more about vaccines. And with vaccines, obviously, it would be important that we get messages that are targeting the group that is still on the fence. The vaccine hesitancy groups, because we can still make some gains there if we send the right messages.
Dr. Mphahlele, before we talk about the impact of misinformation, I'd just like to remind our viewers that they can tweet us any questions or concerns that they have around COVID-19. One of the questions we posed is, have you taken the COVID-19 jab? If not, why? Do you have any concerns? If you are vaccinated, do you think there is a need for a booster? And please share your thoughts with us. And you can also call us on 084-813-3465. Now, Dr. Mphahlele, we are going to be looking at those tweets, and some of our viewers have posed questions. But let me ask you this question. We know two things currently about Omicron as more information is coming out. We know that, for instance, it is highly transmissible, and also there are questions of immune escape. And I mean, a recent study that's just been released today by Discovery, which we will be talking about later on in the program, has also shown that the Pfizer vaccine efficacy has reduced, you know, from the Delta variant to what we are now seeing as the Omicron variant. You know, just what do you know at this stage about Omicron? What are some of the data that has been coming out that you can tell us about?
Well, other than the fact that the virus is highly infectious, it is true that it seems to escape vaccine-induced protection. So the efficacy or effectiveness is not the same like the other variants we have seen, especially the Delta variant. This is the reason why a booster is critically important at this stage, because if you get a booster, you actually increase the effectiveness of the vaccine to somewhere between 70 and 75%. But the 2 doses of Pfizer alone, or the 1 dose of J&J alone, is not quite sufficient to give protection against Omicron. And this is part of the reason we see a lot of breakthrough infections. In other words, infections of people who have received full immunization.
Now, Dr. Mphahlele, what is the impact of misinformation, especially during a pandemic such as COVID-19? I mean, following the announcement of the presidency that President Cyril Ramaphosa was infected by COVID-19, a lot of people coming out to say, how is it possible that he was infected with COVID-19 after he's vaccinated? You know, just talk to us about some of the misinformation that is out there and the damage it might cause.
Yeah, I hope this will not be misconstrued as if, the vaccines are not doing their job in this case. So what we know with the current vaccines is that you don't get long-term immunity. So there is waning immunity. And this is the reason we need a booster. And I can't tell you how frequent the boosters are going to be going forward. Time will tell. And then the other thing is that we are getting to understand more about the SARS-CoV-2, that being a coronavirus, it behaves more or less like other coronaviruses, because coronaviruses are the cause of common cold. This is the reason every year you do get a common cold, because there are infections almost on an annual basis. Different versions of the viruses are circulating at any time, and the one variant does not necessarily, give you protection against the other variants or versions. So this is the reason why we get variants circulating and people getting reinfected despite recovered, from previous infections. So those are the 2 things that we know about, coronaviruses, and also about the current generation of the vaccines.
All right, thank you so much for that, Professor Mphahlele. So if you've just joined us, we are in discussion with Professor Mphahlele, and he's debunking all the myths about COVID-19 vaccines. We've asked you a question on our Twitter line, and we've got some of your questions and concerns. Zenzele Nduli is asking, why are you suppressing valid questions about the COVID and the vaccine? Why are people's rights to think suppressed when they feel there are inconsistencies with science advice? What can you talk to us about that? A pertinent question, Professor Mphahlele. Obviously, a lot of people now very skeptical about some of the data that has come out and presented itself so far.
Yes, perhaps it's about the timing and how soon we are able to recalibrate the messages as new informations emerge. You will recall, for example, that we used to talk about herd immunity. And now we know we're not going to achieve herd immunity with this virus for some of the reasons that I've already given, waning immunity and reinfections. And the other thing that we need to recalibrate at this stage is the fact that SARS-CoV-2 is going to be here with us for some time.
All right, let's go to our call lines now and speak to Soli and hear what he has to say while Professor Mphahlele's line is recovering there. Soli, good afternoon to you, and thank you so much for calling in. What are some of your concerns about the vaccinations, especially where COVID-19 is concerned?
Okay, thanks for your time, ma'am. My concern, I just want to find out from Dr. Mphahlele there about between Pfizer and J&J, because now we are on microwave Omicron in 4th wave. I just want to know which one is it better than that can maybe be more effective, or maybe fight Omicron that that you are on. I don't know if you get my question very clear or what.
I do. Thank you so much, Soli, for that question. Professor Mphahlele, are you still with us? Did you hear the question?
Not all of it. I've got a challenge with the connection. My Wi-Fi is very, very unstable. Maybe you can just repeat the latter part of the question.
Soli essentially asking, with the new Omicron variant, what is the most effective vaccine that one can use now? We know that with the Pfizer vaccine and the J&J, these were obviously very much, efficient as it related to other variants like the Delta variant. So in as far as the Omicron variant, which is the most effective vaccine? Or like we've been seeing now, should we be taking booster shots if we've had previous vaccines?
Okay. Yeah, no, very, very important question. The data that we have so far is that between the two vaccines, you're not going to get 100% effectiveness. As I indicated earlier, with Pfizer, we know that if you get a booster, it will increase the effectiveness to somewhere to 70 to 75%, but not 100%. So, which means that there is still a gap. And I don't know about the J&J vaccine, but it's safe to say that you're not going to get 100% effectiveness with the J&J vaccine as well. It is important that we all get boosters so that at any time protection level is high enough to counter against Omicron. So that is the message that I can actually leave with the audience.
All right, let's continue to just take some tweets from, this one is from Tula Sizwe Maseko. How do they give one vaccine to different immune systems? Hence, we panic because our immune systems are not the same. Some are very weak and some are very strong. Those that are weak, the vaccine might finish them off. But don't take my opinion. I'm just thinking, nje. And that is one of our viewers just asking that question, will vaccines provide that efficacy that we need given our different immune systems? Professor?
So we all respond differently to vaccines. Some people will get a better protection. Others may not necessarily get a better protection because of underlying factors, like the immunocompromised individuals tend to respond a little bit poorly to any vaccine, not just COVID-19 vaccines. So in that sense, obviously, I would say that the question is quite valid, that not all of us will respond the same way. And the most important thing is that if you get boosters, then you stand a good chance to protect yourself against the Omicron variant that is circulating, because certainly the current doses, 2 doses Pfizer and 1 dose J&J, are not good enough to protect you against Omicron variant.
Mphahlele, let's take the last tweet from Burning Bush Network. My question, if the vaccines do not provide immunity and millions of people have recovered without them, why do these so-called experts recommend the mandating of them, and why are all other remedies suppressed and only vaccines vehemently pushed, even to the jeopardy of democracy?
Yeah, so the issue of vaccine mandatory will remain controversial because perhaps we fail to communicate the message. As I said in many fora, the reason we get the vaccines at this stage, we know that it's not to prevent transmission of the virus. However, is to make sure that if you are infected, you don't suffer severe form of disease, and you are less likely to die from infection. So the vaccination gives you that protection. You will see that even the people that are being reinfected now with Omicron, because they received 2 full doses of Pfizer or 1 dose of J&J, most of them will suffer mild disease. So the issue of booster is just to ensure that the protection level is high enough that you are able to fight against this variant. So once again, just to say that the purpose of vaccination is to prevent severe disease and also to prevent mortality associated with the infection.
Prof, actually, one more question just squeezing in there from Kwena. Are vaccines still on trial phase? What are the adverse side effects?
Well, the side effects are well documented of the different vaccines that we are using during the clinical trial stages. And even now, when the vaccines are being used in the public is highly encouraged to report any side effect that they might get from the vaccine. So all the side effects that we have seen so far, they are expected. They are in line with other vaccines. And we have not really seen anything untoward related to the COVID-19 vaccines. So there might be 1 or 2 cases where it's an issue of timing, where somebody receives the vaccine and then something unfortunate like death happens immediately within a few days or so. But these cases have been fully investigated, and we know that there's no causality with the vaccine.
Prof. Mphahlele, all right, there's a caller. Let's probably take that call before I say goodbye to you. Elijah from Mahikeng, welcome to the show, Elijah. What's your question or concern?
This tune, press 1.
All right, Elijah seems to have dropped his line there. Prof. Mphahlele, obviously a lot of awareness still needed to be done, just judging by the number of concerns that we are, facilitating and fielding here on SA Today. Thank you so much for your time this afternoon.